Okay, welcome everyone to the webinar today. Today we are doing part 2 of our oral health webinar on social determinants of health. My name is Nihei Jung and I work as a Community Advocacy Director at California Pan-Ethnic Health Network, CPEN, located in the Los Angeles office. I will be your facilitator today and I'll introduce some of the slides and I'll handle the Q&A afterwards. Next slide. Great. So we are talking to you about why social determinants of health matters, specifically relating to oral health today. So before we get into the webinar, I'm going to provide you with a few housekeeping items. So we have muted all of you. So if you have any questions, we've enabled a question feature on GoToWebinar to ask a question. So you may need to click the orange arrow to show the control panel, and there you'll see the question box. If you think of a question for the speakers at any point, just type it in there, and somebody from CPEN will be monitoring, and the questions will be given to me at the end, towards the end of the webinar, and I will be moderating the questions with our speakers. Today's webinar is being recorded, so we'll be able to share a link with you after the event is complete. So you can share the recordings with your coworkers and other partners that you have, and we're also going to be sending out the PowerPoint presentation, so you don't have to worry about missing that. We welcome you to revisit the content yourself afterwards. Please take a moment at the end of the webinar to complete a quick evaluation survey. At CA Open, we really value your feedback. It helps us to measure our work and to adapt the rest of the webinar series or any other webinars that we'd like to do in the future. Okay, next slide. Okay, so this webinar is hosted by the California Open. California Open stands for California Oral Health Progress and Equity Network, CA Open. We build a healthier state by making sure that all Californians have the keys to access good oral health. Next slide. So CA Open currently is building collective power to ensure that good oral health is a fundamental right for all Californians. We bring people together, including providers, advocates, policymakers, to exchange ideas, share resources, and collaborate for oral health equity. Access to good oral health is like going through a series of locked doors. Some people have all the keys they need to unlock these doors, such as, access to fluoridated water or a job with dental benefits, but others are missing some keys. So without full set of keys, people won't be able to access good oral health no matter how hard they try, right? So by working together, we can help people get the keys they need to unlock the doors to good oral health. So the Grassroots leads organizations that are presenting today, you saw some of the logos on the earlier slide. They're a critical part of the California Open, and they're members of the network as well. So today's presenters will talk more about their own organizations and the work that they do, but as a group, they ensure that California Open's approach is equity and social justice focused. So today, we are going to take a deeper dive into what social determinants of health are. We had a part 1 of this webinar, so we're doing a furthering of studying the topic and why they're important to our work, whether you're a clinician or administrator or play, other critical role in patient care. Our goal today is that you'll be walking away from today's webinar with a much better understanding of what your patients or clients might experience when navigating their oral health care needs. So what is the definition of social determinants of health? It is the conditions in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Through our collective work as a grassroots lead organization, we have chosen to prioritize the following social determinants of health for the purpose of today, which is economic stability, healthcare systems, education, built environment, social engagement. Next slide. Great. So here on the slide, you see that purpose of webinar of the last webinar we did, which is introducing the topic. And today we are taking a deeper dive and presenting grassroots approaches to address social determinants of health challenges and share promising practices on addressing them. Next slide. And next slide. Okay, so I already went over this. And next slide. And next slide. Okay, so I'm happy to pass this over to the next speaker, and I'll let that person introduce themselves. Thank you.
Hello, this is Mayra from Scope. Can we go to the second slide, please? So at Scope, first of all, a strategy means, it's a general plan composed of different steps and activities toward the achievement of a goal. So in Scope, we do a lot of community outreach to ID and develop leadership among the community members, the Black and Brown communities in South LA. And they participate civically to grow their political education. Because we know we need to address the health inequities in low-income communities of color by understanding the root causes and the social determinants of health. And also, we believe that people most impacted by the problems and conditions had to be inside in the solutions to create change. That's why we put a lot of work on identifying and connect members with a common problem and major legislative issues here locally in Los Angeles, also in Sacramento, and finally we did in Washington, D.C. And one of the keys is to share their real stories so we can create conscience and raise awareness among decision makers in our state. And something that they want to show right now is the real testimonies. So they want to show how the scenarios can be different, but they are very consistent with analysis of the oral health survey. Can we go to the next slide, please? That we conducted in 2016. The two of them were part of the 2016 surveys that we did in California, and they said the problems is still in their lives, day a day. So they decided to share with you today to show the reality of the oral health system in California. We can go to the next one. We have Irita Fernando Nelson. Irita Wormsley, she born and raised here in South Los Angeles, and she said that as a recipient of medical, sometimes medical don't pay a lot on repairs for her teeth, so they prefer to pull, their teeth, and sometimes cost a lot of money because medical only cover maybe X-rays and that's it, and sometimes the dentist ask them to pay over $2,500 money that she doesn't have because she's low income families, and sometimes the dentist prefer to pull 20 teeth rather to saving two of them. So, and also she knows that invest in more in dental oral health is important because an example, she's a person with diabetes, she's diabetic, and she knows she needs to be able to take care of her chew and digest, digestions on any kind of food. So she knows that right now is the time to address this situation and force the government to care more about the oral health in California. So now I'm gonna give to Yesenia from CBHPI, who's gonna explain how her work is related to Irita testimony.
Hi, everybody. Can we go to the next slide? Thank you, Mayra. So my name is Yesenia Silva, and I am part of the research team in the Central Valley Health Policy Institute. And so a little background of who we are. We are a research institute in the Central Valley. We are part of the College of Health and Human Services in Fresno State. And the work that we do is grounded in evidence-based work, evidence-based research practices. Also, we do community participatory research, and all of our work is possible through the partnership with local community-based organizations and federally qualified health centers across the San Joaquin Valley. Can we go to the next slide, please? Thank you. So as Mayra mentioned, we part of our work throughout the last couple of years has been specific around what are the challenges of the underserved communities in the Central Valley. And what that means is challenges for medical beneficiaries. So in the last, in 2015, we did a landscape assessment of what are the perception, knowledge, and attitudes about oral health in 5 counties throughout the San Joaquin Valley. We went to Merced, Tulare County, Fresno County, Madera County, and we found that there's one of the biggest barriers was the need for culturally and linguistically appropriate oral health information and services for medical patients. And so we also found that there is a lack of oral health training for promotoras and community health workers who are the individuals who tend to provide culturally and linguistically appropriate education to residents. And so in 2018, we also did another study to find out what were the attitudes towards the medical dental system of medical recipients. And since the first landscape assessment in 2018, it looks like barriers have not really changed, although we had some increase of benefits, dental benefits, right? So we still found that medical beneficiaries experience barriers on cost. There is providers insensitivity to patient cultural needs. Another barrier that the medical beneficiaries expressed was fear, as well as language and availability of providers that could be nearby where they live and who accept Dentica. So what that meant pretty much is that we still have work to do, right? In order to increase access to medical patients. So can we go to the next slide, please? So some of the strategies that CVHPI has done to address those locked doors has been that training and educating oral health providers and other educators, for example, promotoras, community health workers, and case managers, giving them a deeper understanding of what oral health means and how it's connected to the general health, as well as what are some of the resources available for patients in medical beneficiaries in the Central Valley. Another strategy that we have taken, another key for it has been trying to understand what are the provider challenges with the identical system. So on one side, we have medical beneficiaries who experience barriers, but we also felt we had to understand what was the providers' challenges navigating the identical system. So we can go to the next slide. So now I pass it on to Eddie.
Actually, it's me, Mayra. I'm sorry. Yeah, Nelson Ayala, he's living here in South LA for almost 30 years, and he has health insurance through his employer. But sometimes he's not able to pay for a private doctor, you know. And in a specific case is that one time he went to the dentist, and the dentist recommended a gum disease treatment, and they asked for like a 3,000 to 4,000. So, and he found out that wasn't covered by his plan, but also he learned that he didn't need the treatment. So, in his experience, he said that they were trying to get more a profit instead to taking care of his health, oral health. Also, he said that sometimes, you know, he noticed that health insurance have become a business, not really taking care of people's health. And it's more like business and way of profit that taking care of oral health becomes a second place for people like him. He said that during his time when he was came as a teenager, he remembered his parents qualified through medical, and he said by the time from now, he noticed that it hasn't no progress at all. Even with his insurance right now, is the same coverage, the same benefits for over the almost 30 years. And also, he says sometimes is when he go to the doctor, he get charged for X-rays when usually not supposed to be in charged. And he asked again and again, and they had to pay $60 every time he go to X-rays when his plan say that it's free. So, and he's a full-time worker as an engineer. So now I'm gonna pass to Eddie, who's gonna talk about Triple AJ. He's gonna talk more about his community work connected to Nelson Ayala scenario.
Thank you, Mayra. This is Eddie Hu from Asian Americans Advancing Justice, Los Angeles. Just one thing we want to go make sure that we will have additional video testimony sent out to you, so you will hear from the patient that we're highlighting firsthand and understand what they are, what the reason are. We're going through these testimony and have a better sense of more comprehensive knowledge since you'll be able to listen to them. So can we go to the next slide? Oh, it's already on the next slide. Thank you. So one of the things that Mayra highlighted is all of these challenges has been experienced by the client. And he has said multiple times that he felt the system has become very profit driven. And he also experienced a lot of upselling, which is, Myra mentioned, is something that he didn't need, which is the gum disease treatment. There are also some predatory practices. So there are some provider out there that they know services are being covered, but they are not. They're still charging the patient for it or doing some sort of balance billing, which is also the improper billing. So for folks who are in Medi-Cal, that the population that we work with, they are not supposed to be billed for anything, but in some cases for the private, which is employer-based insurance, they can balance bill, but it's not. It's still regulated, And then the very last point that he mentioned is the lack of health practice advancement or innovation. So he mentioned that it's since, well, Maida also mentioned that since his teenage year till now, he probably didn't really see that many innovations. Can we move on to the next slide? So this is the research that we done as a Grassroots lead organization. So all of us are part of the Grassroots organization with the CA Open, which and also part of the National Open. In 2014 to 2016, we have did a series of survey, and these are the survey results that we got, which very mirror of what Nelson has mentioned. So as you can see from the graph above that even folks responded a large number that they have insurance, but they have not used it due to many factors. One of them will be cost. The second one is competing demand, like food and shelter or childcare. And then there's also barriers like transportation, lack of understanding of healthcare system, and lack of trust in the healthcare system. If you look at those red boxes that it's in the graph, majority of people with oral health coverage still find their coverage too expensive or not covering their service that they need. So if you look at the private insurance side, there are a lot of people worry about the cost, and then the gray bar is just saying that there are also there's like 40% of them, the respondent, have found that they don't cover the service that they need. And if you look at the public insurance side, which is what we have in California, Medi-Cal dental, it's a lot of them responded that there are not enough services within the system that they are enrolled in, which is Medi-Cal dental. So to tackle those challenges, if we can move on to the next slide. Thank you. To tackle those challenges, Advancing Justice had engaged with has two major strategies that we use. We primarily monitor the implementation of the ACA, including Cover California, Medi-Cal, and private insurance through community engagement and partnership with local organizations and community-based organizations. We use the knowledge that we gain from this strategy one and bring it back to the different agency to inform them about the experience that the clients within those systems are experienced. Sorry to use experience a lot. And the second strategy that we have is policy advocacy, administrative advocacy, and uplifting community stories, and work with the stakeholder engagement group and coalition to address those challenges. So the strategy is very, very tightly knit together. So we work with the local based organization, and then we bring all their stories and share them with the legislator. This concludes my section. So I will bring Myra back to talk about the uninsured population and their experience.
Please, can we go to the next slide? Fernando Espiritu, he's a working adult without children, and he doesn't qualify for medical because he's making more money, but so he has no medical insurance. Fernando Espiritu, he say as a low-income person, he's challenging for him and his family, when they need to find a helper, including dental visits. Going to the dentist sometimes forces him to make a decision to sacrifice to pay for gas, especially right now with these prices, groceries, or another living expenses. And also he say without insurance, a typical routine dental cleaning, send him back to pay 150, sometimes 250. So it's when he decided to, to share his experience and share, his testimony. And also he say they're creating a workforce of dental therapists and dental hygienists will expand access to people like him who needs quality oral health care in communities like South LA. And I know Eddie mentioned already that you guys gonna receive the video so you can hear from them. Now I'm gonna pass to my colleague Gloria from Scope. She's gonna talk about our community work connected with Fernando's story. Thank you.
Hello, good afternoon. This is Gloria Medina with Scope in South Los Angeles. And so we're very glad to be part of this conversation, as this conversation has been, we have experienced a very important issue for our members, particularly in the last 4 to 5 years. So I'm going to talk a little bit more about uninsured patients and what we have heard. What is really the experience that is coming from the ground in terms of being uninsured and not having the care necessary to really meet the oral health needs. So if we can move to the next slide. Thank you. So I just wanted to elevate here this issue about uninsured patients. As you all have heard already, we have all been involved in surveying the community, getting really firsthand experience of what it is to live, for example, in South Los Angeles and other low-income communities of color, and having to deal with the lack of access and affordable health insurance or oral health care. As you heard, Fernando is a working adult, but he's still low to medium income without insurance. So he has no oral health coverage. I would like to say that this is an exception to the rule, but it's really a large majority of the people that we serve here in South Los Angeles. And through the surveying that we did, it included the majority of the folks who responded to the survey were between the ages of 25 and 54, which was 75% of the respondents. And so through having analyzed the survey, we really were able to highlight that there's this gap among our population who are uninsured. We are very grateful that there is some coverage in California. Children have access to some type of public dental insurance or oral health care services. And obviously seniors, 65 or older, and disabled. But there's this huge gap of folks who are either employed and do not have insurance as part of their employment, or folks who are unemployed and underemployed, not working enough hours to even have any significant benefits. And so this is a very serious situation in South LA. And these are conditions that need to change and solutions that we need to find to address these needs. And so, as Maida has shared, Scope, the work that we're doing is particularly to make sure that the folks who are most impacted are at the forefront of identifying what is the root causes, or the root causes to these problems, and also what are the solutions that will really create and bring about change. So I just wanted to elevate some of the things that don't come necessarily from us as some level of experts, but really that comes straight from the community. One is that working adults and some seniors who are not yet eligible for coverage in our low-income communities experience this gap of dental coverage. Most significantly is that they have lack of the preventive dental care. And as you heard in the previous example, even as being able to afford x-rays or just regular checkups, that is not an option. That is not something that's accessible to many folks who are part of this gap. And so, as we all know, when you don't have that preventive care, then you are then the result is that you need to then take care of emergency, invasive, and expensive procedures. So one of the things that we have learned is that by the time people or folks, seniors particularly, have access or are eligible for some level of care, the need is so great in terms of the invasiveness and the expense that the coverage that they do have under public insurance does not cover what they really need, just to make sure that they're addressing some of the basic needs as a result of not having preventive care. The other thing is that uninsured adults and seniors have a difficult time making decisions, as Maida had mentioned, about paying expensive out-of-pocket dental care and basic necessities. We know that oral health is just one of the issues that our members are facing. There are definitely other issues around health or general health, but also just other economic impacts that folks are facing. And so the decisions are very real. As we surveyed folks, it was the responses were very evident that folks knew that oral health care is extremely important. They understood the connection between oral health and overall health, and they prioritized it. And they did everything they could as individuals to make sure that they were taking care of their oral health, but still acknowledging that not having access really just created really impactful problems. The other thing was that we kept on seeing that folks get caught up in a cycle of debt. So there are some clinics that provide credit for folks who maybe don't have a good history of credit or don't have the income to easily get credit, but they provide a credit that really puts folks in a cycle of debt when they have to then address emergency dental care, where most of our respondents said that the time when they do go to the dentist or they seek care is because the pain is just unbearable, that it impacts just their overall quality of life and their ability to, for example, go to work or take care of their children. The other thing that we also saw was that one of the other ways that they address access is seeking services in unlicensed underground clinics. Again, putting them at risk in terms of infection or other complications for going to seek services in a place where was not unlicensed, and so that creating again this cycle. Can we go to the next slide, please? So some of the long-term impacts that we have been having conversations with our grassroots members is that the lack of dental care has an impact on unemployment and underemployment. So this is a very key issue when we're talking about the cycle of poverty. Folks understanding that if they have we know that oral health is way beyond any dental cosmetic care, but that the fact that when people are having their teeth extracted because that's the only thing that is covered, maybe by some emergency public health insurance, that not having a full set of teeth is impactful in their social life, but more importantly in their economic life when they're not given the opportunity for employment or underemployment. Of course, also impacting their self-esteem. The other thing is that low-income community residents also experience serious health issues related to dental disease. So we have heard countless stories from our community folks who have ended up in the hospital for long periods of time, addressing serious overall infections to the body that might have started with an abscess or some sort of infection in the mouth that could have been prevented. So the impact is not only economical in terms of, or financial in terms of the inability of people to work or gain employment, but also the impacts in terms of having to address more serious long-term health issues. And community residents report also that there has been a lack of trust in dental care delivery system, and also particularly in local providers based in traumatic experiences. So these traumatic experiences a lot of times are connected to the trauma of feeling like they haven't had a real, honest conversation with their providers about the cost of things as small as a cleaning or a deep cleaning or x-rays, and has left them traumatized, but also just the trauma of not receiving quality care and then experiencing other complications. So as a community-based organization, for us, what is priority is, as I mentioned before, is to engage folks in a real, genuine way to address these problems. And some of the things that our community members have elevated that they think can help create long-term change is really the increase of Medi-Cal coverage for working adults and seniors. So expanding the amount of folks that could be covered. Additionally, really looking at the delivery system that we have right now and shifting it from a small business for-profit model to a public health issue that is grounded in health equity framework that really gives people an opportunity to have access to real care. And then thirdly, increase trust in oral health, in the oral health delivery system through the creation of a mid-level provider workforce, focusing on career pathway opportunities for low-income communities of color who have historically been left out of the oral health sector in terms of the workforce. And so this is something that our community members are really excited about exploring. What would it look like for a workforce that really allows folks to think about a potential career in dental care, but also that it would increase access so that people would be going to their local clinic down the street in their neighborhood where they would see people who are the providers, who look like them, who have similar experience about what it is to live in a low-income community, and what are some of the issues, some of the challenges, and the determinants of health that really impacts people's ability to access oral health. And so we are continuing this work beyond having these preliminary conversations with community folks. We are having an educational campaign that is led by Grassroots community members to really elevate the importance of oral health in our community, and also to open up even a deeper conversation of what we really need to have true access to oral health. We're also building a network across the state to really think about what is a vision, what we could really aim for in terms of a mid-level provider workforce that is grounded in oral health, bringing in experts to really help us look at what might be possible. And we also have a committee of grassroots members, grassroots leaders here in South LA that are helping us continuing to explore more possibilities about what long-term change really might look like in South LA and other communities that look like South LA throughout California. So I will now pass it along to the Latino Coalition for Healthy California so that they can walk us through some additional practices that are also being pursued.
Thank you, Gloria. My name is Abigail Ramirez. I work with the Latino Coalition for a Healthy California, and our mission here is to advance and protect Latino health through policy and advocacy to end Latino health inequities in California. And if we could do the next slide, that'd be great. Thank you. Thank you. And now we will be discussing the various ways in which organizations are working with community to address and elevate social determinants of oral health. It is my pleasure to introduce my colleague, Monica Mares. She is a collective impact coordinator here with LCHC. Next slide, please. Oh, next slide. Did you get the?
Thank you. Thank you, Abby. It's my pleasure to speak about LCHC's Health Ambassador Initiative, which launched over the summer. Again, my name is Monica Ruelas Mares, and as a collective impact coordinator, I'm tasked with working with diverse stakeholders in the field of public health at the national, state, and local level. So we can join forces to support the work of organizations that engage directly with community. So the image on this slide actually illustrates our program model. The program brought together the California Department of Social Services, Public Health Institute's Center for Wellness and Nutrition, LCHC, as well as 4 regional partner organizations. By partnering with locally based regional partners, LCHC was able to reach 84 community leaders in total who graduated as health ambassadors over the summer. For this program, we actually used the popular education method to train the ambassadors using a state-approved curriculum. So in the process of planning for the program, we were working with the state as well as PHI's Center for Wellness and Nutrition in terms of the program curriculum and the guidelines that we were going to be training the ambassadors on. So from these trainings, actually emerged a community action plan where ambassadors identified the top 3 issue areas in their community, as well as their ideas for policy systems and environmental change. So ambassadors were tasked to lead trainings in their communities, community conversations with neighbors, families, with neighbors, their friends, as well as their family members. Over the course of 3 months, more than 400 plus community members were reached through this program. So as illustrated in the model, the ambassadors and community conversation participants are agents of spreading the knowledge in their communities. With them, these quote-unquote seeds of knowledge continue to spread in the community beyond program timelines. But I also think it's really important to emphasize that in our program specifically, the ambassadors receive compensation for their time and participation in the training, as well as for completing their community conversations. So LCHC is definitely committed to support the growth of the health ambassadors. We encourage the development of future models of training the trainer or working with any sort of community health work or promotoras to include fair compensation for community leaders. We understand the importance of the culturally relevant information and relationships that they have with community members. If I could get the next slide. So these are some images taken during our health ambassador training.
And the health ambassador trainings played a critical role in connecting health outcomes and social determinants of oral health. Through the Rethink Your Drink training, which is what is being portrayed in the images, community leaders were able to further understand the health outcomes of consuming sweet and sugary beverages, including impacts to oral health. And these same leaders shared this information with other community leaders, which resulted in changes in their eating habits and motivated them to continue their advocacy efforts to ensure healthier and accessible food choices. And it was amazing to see how leaders were training other leaders in the community and bringing awareness about the long-term effects of consuming these type of beverages and the impacts to oral health. And so not only obesity and diabetes, but also oral health, which is something that I think is not often talked about, and they really appreciated having that connection. Again, we're talking about social determinants of health, and so bridging that gap in those conversations, and what other best way to do it than with community leaders who have those relationships on the ground. So that is our initiative here, Leadership Council, Latino Coalition for Healthy California. And now I'm going to be transitioning to Yesenia, who will be discussing the partnerships between advocacy groups and research institutions and how both play a major role in advancing oral health at all levels. So we have the next one. Thank you.
Thank you, Abigail. So like I mentioned earlier, CVHPI utilizes evidence-based research practices to do data analysis. We see that it has been very valuable working with advocacy groups who can take the information that CVHPI produces to inform some of the work that they're doing. So an example has been a research on mid-level providers, specifically the registered dental hygienist an alternative practice model in California, and how is that this model brings access to vulnerable populations and how that looks like in comparison to the dental therapist model. So we see that partnering a research institute with advocacy groups has been very impactful in diving a little deeper on what are the health inequities around oral health in California. So I think we can move on to the next slide. I pass it on to Veronica now from Visión y Compromiso.
Thank you, Yesenia. Hi, everyone. My name is Veronica Arciga, and I work with Visión y Compromiso. We have heard from our partners in this webinar very important information about the needs and barriers our communities face every day around receiving health services. I think it is very important that we all acknowledge that these disparities exist and to recognize that we all can do something to reduce those disparities. Promotoras said loud and clear to us that we need to create awareness always and at all levels on the importance of access to affordable, attainable, and accessible oral health services for our communities. But they recognize that these three things cannot happen without creating systemic changes. In other words, doing advocacy. For decades, oral health has been seen as something that is not part of our overall well-being. It has been seen like as a cosmetic issue, and we know that oral health is more than just dental care. We know that not having access to good oral health services can lead us to low self-esteem, serious chronic health problems like malnutrition and heart problems, among other health issues. Can we go to the next slide, please? According to the Smile California campaign, less than 50% of the Medi-Cal beneficiaries know that they have dental benefits. And here is where promotoras become part of the solution. Education is still needed to shift the culture of coverage, ensure that all family members are covered, and inform families with limited insurance experiences what it is, how it works, and which services are included, including dental services. And in their own language. Mistrust, misinformation, and confusion about ACA, Medi-Cal, and Cover California are very common. Promotoras understand the systems and are trusted messengers for the community. Promotoras are knowledgeable in many issues that impact directly their communities and can interconnect resources to fulfill, or at least to reduce the needs of their community members. So what has it done Visión y Compromiso around the awareness? So Visión y Compromiso created a Promotoras oral health toolkit to motivate the promotoras to start integrating basic but key messages as part of the daily work with the community to highlight the importance of good oral health and the impact in their overall health. We offered a series of educational webinars on oral health to the promotoras, including the importance of understanding the present oral health landscape in California and the social determinants of health. We have offered as well webinars to update the promotoras in healthcare coverage so they can inform the community of new benefits, resources, and how to navigate the system. We have promotoras that facilitate workshops in oral health for parents in different settings, rural, areas where it's very complicated to teach, but they are there. And Visión y Compromiso has become an ambassador for the Smile California campaign, which was created to inform the Medi-Cal beneficiaries that they are entitled to dental benefits and how to use them, and even how to find a dentist near their home. We have partnered with other organizations to train promotoras in oral health, like Healthy Smiles, and Visión y Compromiso has participated in radio interviews with KPFK and Radio Bilingüe to talk about the restored oral health benefits for adults. The promotoras have shared fact sheets about the restored oral health benefits for adults at our promotoras regional events, and we have a lot. And we have ensured that dental providers participate in oral health fairs, not in oral health, but in health fairs to screen adults. And we have our own Facebook page, oral health Facebook page, where we are often uploading updates on oral health. On the advocacy side, we have our Promotoras Advocacy Committee, which is composed of promotores from across California. Our promotoras have been trained in how the legislative system works. We have motivated the promotoras to do local visits to their legislators and to participate in our Promotoras annual legislative day in Sacramento, where promotoras from across California visit their legislators to educate them in the emerging needs occurring commonly within their communities, including bills on access to health coverage and oral health services. We are very lucky that in California, all Medi-Cal beneficiaries receive dental benefits. In 2016, California passed Health for All Kids that expanded medical coverage to undocumented children under 21 years old. This year, Governor Newsom allocated money to expand these benefits to all undocumented youth until the age of 26. And this is something that is going to start happening on January 2020, very soon. And many organizations are now advocating to expand this benefit for undocumented seniors 55 and older. And we just heard Gloria talking about the needs that they have. Vicente Compromiso and its promotoras are involved in several oral health coalitions representing the voice and needs of the community, as well as in Health for All coalitions, including advisory seats on local community oral health improvement plans. And promotoras are already taking part of the new workforce development around oral health, and we want to ensure that they have the support and the validation of the wonderful work that they are doing for our community. Next slide, please. So there is much more still to do, and I just want to share with you that all grassroots organizations in this webinar, as part of the National Open Network, participated last week in the historic Hill Day that took place in Washington, D.C., where we had 3 asks, and you can see them right here. And I know we are short in time, so I'm not going to read them all. I just want to highlight the last ask that we did, which was to Congress should allocate an additional 17.5 million for a total of 36.5 million to fund the CDC Division of Oral Health to support an oral health program in every state. So please help us to move that forward if you can. Next slide, please. And lastly, here you can find all the resources that I have mentioned to you during my brief presentation, in case you want to read them or find them in our webpage. So now I will pass it to Eddie, who will be talking about our conclusions.
Hi, this is Eddie again. Thank you so much, Veronica, for presenting on your information. We want to conclude the webinar to showcase a little bit of, well, to wrap up and show all the strategy that the Grassroots have used. So we can go to the next page. And next. Right. So we share a lot. I know you heard a lot from us. So we're trying to condense everything from on like a one slide. So feel free to read this at your leisure. You already heard the strategy from us, and these are just a condensed version of what we talked about. And we can go into the next slide. This next slide is to reiterate what kind of issue and challenges that we highlighted throughout the presentation. And we're also presenting some sort of some more solid step that you can help us participate or help us or provide support. So we break it down into grass middle, which is the state right representative, and these are all important asks that we have for you. And then we also have the grass top, which is what we label them as national representative. That includes statewide provider organizations, oral health plans, director of different health departments, as well as funder. Mainly, it's just showcasing you that the ways that you can help collaborate with us and help provide support. So we have a quick 4 minutes left. Is there any question from anybody? Should we move to the question?
Thank you, Eddie. Yeah, thank you. Okay, so we have 4 minutes left to the webinar today. Thank you, everyone, for presenting. This is really, really great information. Today we went over needs of the communities, and I know A lot of folks are always asking for community stories, and by us sending out the video links, we hope that you'll be able to learn from those stories. And it's really helpful that you put together, what kind of support we need in order to address the social determinants of health challenges. So please go ahead and put in your questions now. We have one question. It says, will these slides be available or emailed to us? Yes, these slides will be available to you. And we've added all of our contact information on these slides so that you can get connected with us. Okay, so I'm just going to give just one more minute for questions to come in, but just one short question for you all. I guess looking at 2020 next year, is there one major effort that you really need support on? And this is just question, for any of you.
We are advancing justice. We're doing a lot of work around language access and trying to monitor all the services that Denti-Cal or Medi-Cal Dental provide to make sure their language are accessible and appropriate for folks. So we are working with this coalition and another group to work on addressing those, getting stories and highlighting those challenges to the state. So if you have any of those, feel free to let us know, and we will happily to pass those information or challenges up the stream.
Hi, this is Veronica with Visión y Compromiso. I think one of the things that we can ask your support is to really get informed about public charge, the issue about public charge. Our community is really afraid of that, and it doesn't impact everyone of the immigrant community, but it does to some others. And I think it's important not to create more fear among them, but to be aware that it's something that is happening with our community, and we really need to be informed in what exactly it means public charge. Thank you.
Hi, this is Gloria Medina from Scope again. I would just re-elevate that we are building this network across California to really explore the possibility for a mid-level provider workforce that would be accessible to low-income communities of color as a career pathway. So if there are folks who are interested in that work, they could reach out to Scope, whether it's resources, expertise, data that would help us get to a place where we could really craft the best agenda for this work moving forward. That would be amazing. So folks who are interested can reach out to us and we can give you more information.
Hi, everybody. This is Yesenia from the Central Valley Health Policy Institute. And we do not have a direct ask, but we do welcome everybody to find us look at our website, and where you will find access to all of the information that we have put together throughout the years being involved in the oral health work. All the information that we present can be utilized for any asks that you guys may have.
And this is Abigail with the Latino Coalition, and I know we're out of time, but quickly also addressing language access and continuing to push for universal coverage for adults and seniors, and that they have a comprehensive plan for oral health.
Great. All right. Well, thank you so much. Oh, go ahead. Oh. Okay, so we're actually out of time. So, please feel free to connect with us. And I know there's a lot of county folks that have joined the, social determinants of health webinars, and know that, the local oral health programs that are being administered through the counties require community engagement. So please connect with us. A lot of our organizations have partners all over California and can work with you to make sure our communities get the support and the resources that they need. So thank you so much for joining the webinar today. And thank you so much for being part of California Open. And feel free to go to our website to learn more about the work that we do. And if you want to partner with us and do these sorts of webinars, we're happy to support that effort. So thank you so much. We're going to close the webinar now. Thanks.